Hello, good morning, and welcome for the 9th IFSO Journal Club. Today we've got with us Dr. Michal Janik, and Michal is from the Department of General Oncologic, Metabolic and Thoracic Surgery in the Military Institute of Medicine in Warsaw, Poland. And Michal's paper was chosen by the IFSO Facebook group to be presented today, and it's about a very important topic that we're seeing more and more patients of this age group. And the paper is entitled "The Effectiveness and Safety of Roux-en-Y Gastric Bypass in Elderly Patients." Michal, good morning. Hello.
Good morning. Good morning. Nice.
And welcome. Why do you think these questions are more and more important these days?
Well, I'm a researcher, but I'm also a surgeon, and all my research is connected somehow to my daily practice. Recently, more and more elderly patients come to my office and ask for surgical weight loss. And when we look at the numbers and the fact that our population is aging, it is clear that there will be more elderly patients who will seek for bariatric surgery. So there is a problem because we do not have clear guidelines for this age category. So my research team came up with the idea to look into this topic and look for the current studies because we want to know what is a risk-benefit ratio in this age group. In my opinion, this information is essential for every surgeon and patient because the acceptance of complications in bariatric patients is very low. So in this particular study, we compared the safety and efficacy of Roux-en-Y gastric bypass in patients over the age of 60 with the younger ones.
Thank you. Tell us a little bit more about how you conducted the study and the papers that you've chosen.
So in cooperation with the research team from Krakow, we did systematic review of medical databases like PubMed, Medline, Scopus, Embase, and Google Scholar. We look for studies that compare Roux-en-Y gastric bypass in patients over 60 years or above with younger ones. We decided to choose the 60 years as a cutoff because this criteria was used in the majority of bariatric studies as we checked out. Of course, we can argue about this cutoff, but this is not an issue. So we looked for studies which included information about weight loss, short-term complications, and the impact on comorbidities. We started with 2,000 articles, but after screening these articles, we end up with 9 studies, and we find pretty interesting results.
Can you give us a summary of those results, Michal, please?
Yeah, so at the beginning, I like to point it out that we need to be very cautious in interpreting these results. For sure, our study emphasized that we are short on the data about the efficacy and safety of Roux-en-Y gastric bypass in the elderly populations. However, we found out some disturbing results. First, the mortality and morbidity was higher in elderly group. And second, the efficacy is worse in comparison to younger ones. So it turns out that gastric bypass it's not so safe in elderly patients and it's not so efficient. So it's not so good information for the surgeons and for the patients because the message seems to be clear. All people risk more and gain less. But again, I'd like to point it out that we need more data on that because the quality of current evidence is strongly limited to level 2 evidence. I especially would like to see studies on efficacy and overall mortality reduction in long term. And I think from patients' perspective, it'd be very good to know how bariatric surgery, especially gastric bypass, affects the quality of life in elderly.
Michal, do you think that the results that you got, i.e. this higher morbidity and the higher mortality, is what we are actually seeing in day-to-day practice, or do we have techniques by sort of choosing the patients better? What do you think?
So I'm afraid, yes, this is what we are seeing in our daily practice. So from different studies, we know that age itself is a risk factor for perioperative complications, not only in bariatric surgery, but also in other kinds of surgery. And all surgeons are aware of that. The problem, in my opinion, is that it looks like Roux-en-Y gastric bypass is not so efficient in this group. This group is risking more than others. So there's a question, is it worth it? And I think it is worth it, but we need more studies on that. And I also think that we need to look for the procedure which could be safer for elderly patients. So in my opinion, we should maybe pay more attention to workup before the surgery, and we need to think a little bit more about the type of surgery we choose for our elderly patients. So once I did a research based on MBS-QIP, which showed that sleeve gastrectomy could be a better option in comparison to gastric bypass in elderly patients. So maybe this is a good direction. However, knowing the results of our analysis, which we are discussing now, in my opinion, it is mandatory to inform our elderly patients about higher risk of surgery at potentially lower benefits.
Definitely, definitely. Are you planning to do the same study with sleeve gastrectomy, or is that something in the pipeline?
Yeah, we have some ongoing studies, and I'm pretty sure you will see the results shortly.
Thank you very much, Michael. We look forward to the Journal Club. That's going to be on the 27th of March, and I hope that you can all join us then. Thank you very much.
Of course. Thank you so much.
Thank you.